Welcome to the Prioritizing Prevention, Translating Science to Practice podcast. Our goal is to prioritize prevention conversations that matter. Our topic for today is Black youth and young adult suicide prevention, with special guest Brandon J. Johnson. Now here's our host, Holly Raffle.
Hello, and welcome to Season 1, Episode 7 of the Ohio Center of Excellence for Behavioral Health Prevention and Promotion podcast, Prioritizing Prevention, Translating Science to Practice. Before we get started with today's podcast, I want to provide our listening audience with a content warning. The content of today's discussion is related to themes of suicide and self-harm. These topics may be emotionally challenging for some listeners. The 988 Lifeline provides 24/7 free and confidential support for people in distress, prevention and crisis resources for you or your loved ones, and best practices for professionals in the United States. Call or text the 988 Lifeline anytime. If you or someone you care about are not experiencing a crisis and you would just like more general information about the 988 Lifeline, please check the show notes or Google 988 Lifeline. Hi, I'm Holly Raffle, the faculty director of the center, and I am grateful to welcome my guest, Brandon Johnson, to the show. Brandon is the chief of the suicide prevention branch at the Substance Abuse and Mental Health Services Administration, or SAMHSA, as we say in acronym world, which is part of the United States Department of Health and Human Services. Before that, Brandon served as the government project officer for the Suicide Prevention Resource Center and the National Action Alliance for Suicide Prevention. On today's show, I'll be sharing a conversation with Brandon on Black youth and young adult suicide prevention. Brandon, it's a pleasure to have you on the show. Welcome.
Thank you so much for having me. I'm excited for the conversation today.
Well, you're newly minted in your role as chief of the suicide prevention branch, but before that, you spent nearly 7 years with the branch as a public health advisor. You've worked on some of the most widely recognized suicide prevention initiatives in the country, particularly for Black youth. So what drew you to pursue a career in public behavioral health?
Yeah, I think it's really, for me, it started with childhood, honestly. So I am born and raised from Baltimore City, and in childhood, I think growing up in really many major metropolitan cities, you kind of see you're exposed to a lot of different things, see a lot of different things that happen within your community. And one of the things in particular that always struck me was this idea of experiencing trauma. So you have family and friends that experience things and see things and that could be traumatic. And so for that, it really lit a fire in me to kind of want to help from that standpoint and to talk about and have those conversations. There just weren't many conversations about it. It was happening. You could see those things happening and having an impact on folks, but not necessarily, talking through the solutions, through how to help, how to be supportive, like all of those things are something that I think we could do more of. And so as I kind of grew up, I got more, exposed to the mental health work. And when I went to undergrad, there was, I was doing a research project around mental health and exposure to violence, during that time. And so someone had asked me, a professor said, have you heard about, public health? And I was like, yeah, but, didn't know as much about it. And so got some more information and ended up pursuing a master's in health science degree um, from Johns Hopkins and really getting into this space and suicide prevention. I wanted to be in violence prevention and suicide prevention being a piece of that. And once I kind of got more educated in suicide prevention and the fact that it was growing in different populations, different communities, it really just kind of stuck with me. And so next month, I think I would have been in the field total for about 10 years at this point. So definitely quite the journey. Didn't expect it to go this route, but I'm so glad that I'm in this space.
Wow, thank you. And how are you taking your personal life experience, your educational experience, and putting that to use in your role at SAMHSA?
Yeah, so I think a lot of that really comes from thinking through um, how can I best represent individuals, communities, and people who don't get the opportunity to sit at the tables that I sit at. How do I take, people's, ideas and experiences where, they want to amplify it, right? They want to be able to come up and find solutions and to be sure to do that and represent that. In the work that I do. And again, like I said, experiencing these things and seeing people experience things within our community, mental health challenges, not being able to find mental health resources, nonprofits who are trying to like get into community and do this work and having those challenges. And so seeing the social determinants of health really impacting people day in and day out from a systemic level, taking those experiences and things that I've seen, really trying to come up with solutions and then pull back and include individuals and communities that don't talk about this as much as others, and having them at the table when it comes to helping to frame things and help with decision making and those pieces as well. So, like what I call, people inside the agency I say like good public health work, right? So, just like, going and bringing, those perspectives with me, I think is an important piece of moving these initiatives forward at SAMHSA.
Oh, I love that, term, good public health work. And so how have you taken your experience, right, and your education, but now you have 10 years of experience in the system itself. How have you grown throughout your journey as a behavioral health professional?
Yeah, that's a really good question. I think with these experiences, one of the things that I always joke about is that I've been government through and through. I started at local government, went to state, and then went to federal. And so in those experiences, I think understanding how each of those levels work and work best, where there are mechanisms for change and impact, and building that in each perspective. So going to the local level, understanding communities at the ground level, towns and systems and things like that, local government, how that works and plays into things, how local politics impact individuals' health, and then taking that with me to the state level and building relationships at the local level as we build out state initiatives. I was Maryland's director of suicide and violence prevention before going to the feds, and building that local perspective in there and hearing from the local communities. And then at the federal level, taking both of those and applying that to the work, by understanding, how those systems work at that level. And I think for me, it's understanding where the barriers are. I think a lot of times it's easy to sit and think, well, why if this is an issue in the community, why don't they just do X, Y, and Z to solve it? And I think my a part of my growth is understanding that there's so many things that can prevent a community, a system, a town from engaging and working to change these things. And so for me, my commitment and my growth is making sure that folks around me are educated in those barriers and helping to find solutions, helping to find ways to better improve systems and communities, as a partner, more so than hey, we sit here, we have the answers, just do this thing, implement this piece, and all will be well. But helping to understand where those barriers are and work to find solutions, I think is a big piece of my growth in the field. When you first get in, you're just like, yeah, let's solve all the problems, and then you understand that it's so layered, so multifaceted, and so building collaborations and relationship building is probably one of the things that I have learned can be more impactful than anything, is connecting people to the right people at the right time with the right resources.
It's so funny that you ended your answer with the word layers because as you were talking, I was thinking about all the layers of the system itself, right? From local, state to federal. And then each community really has its own cultural layers. It has its own priority population, the people who live there, their layers as well. So that was the word that came to my mind. And all of this layering has really well positioned you to do an important body of work that I know you've been tasked with leading, and that's updating the national strategy for suicide prevention. And this is a very vast strategy and it's updated every decade. And part of that process From my understanding, pulls in stakeholders from a variety of levels. I am so curious about this work, and I know our listeners will be too. So I might linger on these questions for a little bit. Um,
No problem.
Tell us a little bit first about, what is the purpose of the strategy and how long it's been around? So if you could just kind of level set for our listeners about the strategy.
Absolutely. So the first strategy, national strategy for suicide prevention, came about in 2002. And so this was the initial strategy to really give the field um, an idea around, how to address suicide prevention, what pieces of it are necessary to support communities, to support systems, and to support populations. And so, with that, the most recent one that has been released came out in 2012. The National Strategy for Suicide Prevention was a collaborative effort between government, the National Action Alliance for Suicide Prevention, which includes like a public-private partnership to end suicide prevention. The Surgeon General's office was involved with it, and outside stakeholders and groups, really to develop what ways can we impact suicide prevention. So it consisted of a number of strategic directions to move suicide prevention forward and a number of objectives. The strategy included data. It included, on top of the goals and objectives, risk factors for suicide, warning signs, risk and protective factors, and went into what government agencies were doing. And it also included some call out boxes around what communities can do, what different systems such as healthcare, emergency departments, law enforcement, what those folks could do as well. So it really built this picture around how we can all get involved in suicide prevention. And so that has been around, like you said, since 2012. And so 2024, we're looking to update that, to revise the goals and in the objectives and the strategic directions around this. And we have a couple new areas of focus for this one that we're working on that I can speak to as well.
Absolutely. So, in my practice, public health practice and prevention practice, I always think if a community can answer yes to three questions, can I do it? Will it work? Is it worth it? They're more likely to be able to update or uptake any of the frameworks or ideas that are being asked of them. So let's go to that question. Is it worth it? Why is this national strategy for suicide prevention so important and why is it worth it?
Yeah, that's a great question. Really, for us, is worth it because suicide continues to increase in this country. Unfortunately, we see it in an additional increase of deaths by suicide from CDC 2021 preliminary data, which is the most recent data that we have and the complete picture that we have. So it's worth it in that sense, even though any life lost to suicide is impactful and is one too many. I think in addition to that, suicide trends have shifted significantly, where it's impacting different populations that at one point in the field were thought to be protected, through another number of mechanisms from suicidal ideation and attempt. And so we're seeing increases in Black youth suicide, Hispanic youth suicide, LGBTQ plus individuals as well. We saw an increase in older adults in the new data that was released from 2021. We saw a significant increase in deaths by suicide from older adults, and it continues to be a rate that's too high within our veteran and military populations as well. So this is something that impacts so many different areas, populations, and regions. It's definitely a thing that the suicide rate in rural communities and frontier communities, American Indian, Alaska Native communities, is still way too high. And so this is really worth it to get everyone on one accord with one path that we can use. A path that consists of many different paths because we have a number of goals and objectives in it, where people can find a place where they can get engaged with it. I talk a lot about lane work. Suicide prevention is too big of an issue that any one of us, any one agency can do it on our own. And so if people can look at the strategy, look at the goals and the objectives and see where they may be able to have impact, is an important piece of this as well. I'll talk through too. One important difference from this strategy to previous ones is that this one would include a federal action plan. So our federal agencies will be putting forward some actions that they are looking to take to move the strategy forward as like this is our example. You can see us. This is how we're looking at it, and this is what we're committing to do. And that action plan will be for 3 years to give us the option of, taking some things out that we've done, adding some new actions in. That gives us the ability to be flexible over these next 10 years that the strategy lives. But this is really something that we see everyone getting involved in, being able to move forward and being able to really have some impact within their particular priorities. But this is certainly an important step, I think, for suicide prevention.
Thank you so much, Brandon. And you really answered not only is it worth it because the document talks about so many different populations and everybody can really see themselves in the document. And we know, like you said, one death by suicide is one death too many. And so I think the value is definitely there. And also talking about the call out boxes, the recommendation, the ways that folks can just honestly say this suicide is a bigger issue, right? We need everybody to be involved in their own specific, content area, whatever that may be. That really helps with can we do it, right? Because it's not something that one group can be tasked to. So, will it work? How does the strategy address that? Like, will it work if we all fall in line with this national strategy?
Yeah, so it's something that we have been considering, and we wanted to use the best available data and information to inform the goals and objectives within the part of the strategy. You mentioned before about just different places where we've gotten feedback on this. I definitely want to make sure this is not just something that one agency is looking at and created and saying like, yes, let's have the whole field do this. This is really an all of government strategy. I think the important thing to mention too is that the White House is behind this and supporting this initiative and this updated strategy, which always helps. There are a number of federal agencies within our interagency work group that is working to help develop these goals and objectives. So we worked with a number of agencies. So, VA, DOD, HRSA, CDC, and IMH. There's just so many people. And again, I could keep going, but there's so many agencies at the table. Before we really got started, we did listening sessions with experts from the field, experts in health equity. The Suicide Prevention Resource Center has a lived experience advisory committee that consists of individuals with suicide centered lived experience to help guide this. We even did a listening session with youth and young adults, which was amazing. I can't talk enough about how wonderful they were in the things that they wanted to see from this. So we were ensuring that we're including voices, people from different perspectives, individuals with different expertise to really drive this forward. And we also wanted to make sure that we were enhancing pieces of this strategy that's different from 2012. 2012, we probably hate to say it, but it was a while ago, right? And so with that, there have been changes and updates to the field, and we wanted to make sure that this document, which isn't completed, I don't want to talk about it as if it's finalized. We're still working, but with that, our intention and focus is one, we really wanted to have a renewed focus on crisis systems and crisis services. 98 did not exist when the 2012 strategy was created. There have been so many different advancements there. The need for improved health equity work in suicide prevention is incredibly important now. For some of the changes that I talked about in the data, it's important for us to address that. So we increase our emphasis there. The intersection of suicide and substance use is an important one as well. So we wanted to make sure that there's a renewed focus there. And young people in technology, even beyond social media. Social media is a piece of it. But youth and technology, how they engage with technology, what that brings emotionally, how we can, use technology as a benefit to young people because that's where they are. That's where they exist. And so wanting to ensure that we're taking the opportunity to be intentional, to be inclusive of changes that need to happen in the field. And so with that and with the opportunity to um, cover each of those things, we definitely believe that this will have impact.
Thank you so much for your leadership and your efforts in this space. I'm looking so forward to seeing the document when it's finally been released. And it sounds like from this conversation, I can tell that all of the groups involved have really put out like, can we do it? Will it work? And is it worth it at the core? And those are things that help motivate
Mhm.
action. So thank you.
Absolutely. Absolutely. Yes. And we're looking forward, anticipating a March 2024 release of the strategy. So we're moving forward towards that goal and working very literally nonstop on ensuring that we can meet that deadline and have this release to the field.
I can only imagine. Uh, well, now I'm going to take us back to December of 2019 when the Congressional Black Caucus's Emergency Task Force on Black Youth Suicide and Mental Health, led by New Jersey Representative Bonnie Watson Coleman, was released. A report was released titled Ring the Alarm: The Crisis of Black Youth Suicide in America, that outlined the state of Black youth mental health and detailed policy recommendations for consideration by Congress. And I'm going to pause here to let our listeners know that we will have a link to that report in the show notes. In that report and in other research, the number of Black children and teenagers dying by suicide is increasing at a faster rate than any other racial or ethnic group. And there are striking disparities between suicide deaths among Black and white youth. Black children under the age of 13 are twice as likely to die from suicide as their white peers. 2 decades ago, this wasn't the case. Knowing the depth and scope of the crisis facing Black youth, how did we get to the crisis point that we're seeing today?
Yeah, I mean, I think that there's a number of reasons for that. One, I alluded to it a little earlier, but in the field because of, consistently lower rates, it was thought that Black youth might have been protected against suicidal ideation, attempt, and death data. I think there's also just hasn't been enough focus with this population in suicide prevention, and also not as much research into the population in terms of suicide rate. And so I definitely want to honor and acknowledge some researchers and scholars in the field who have been dedicated to this work long before it was getting the attention that it is now. The Dr. Michael Lindsay's, the Sean Joes, the Sherry Molocks, the Alfred Breland Nobles, who've really, been leading, and others, and I'm sure I'm forgetting, but that have been leading in this space and saying that this was something that was increasing. But because the numbers and rates were relatively low, it was kind of, not a priority for folks in the field. And so at this point, I think again, when you see things and trends start to creep up, if they're not addressed specifically, if the population isn't of focus and isn't targeted, what happens is that unfortunately it can continue to grow, and because of the lack of research and things into evidence-based practices or practice-based evidence to support and reduce suicidal ideation and deaths within this population. It's harder now when things go up to it's puts us in a different situation to have resources to address it. And so I think some of those things have not helped this situation, put it that way. But I think now we're at a point where individuals, communities, organizations, agencies are tapped into what's happening. And there's been, again, many of it being led by the Congressional Black Caucus's report, have really kind of shone a light on how we can better address this issue.
Thank you so much. And so much of that is, readiness, right? Are we ready to listen? And building that readiness, and that report really seemed to do that for us. How does racial identity impact the experiences of Black youth and young adults facing suicidal thoughts or behaviors?
Yeah, so I think it's, you know, a little less about how the youth themselves kind of see their own racial identity and how others react to it, kind of outside of that. So, because race isn't a risk factor, it's the experiences because of one's race that really impacts um, outcomes for individuals. So we know as a protective factor, being connected to your culture and your identity and having that identity and sense of purpose can definitely be protective of suicidal ideation and attempts. But what we know from risk factors and in that work is that being exposed to racism and discrimination at an early age can definitely impact a young person's suicidal ideation and suicide attempts for Black youth in particular. We know that Black youth are disproportionately impacted by racial trauma compared to other racial ethnic groups. So definitely some things that impact young people and how they're perceived in spaces. We talk about these social determinants of health. We look at additional data. So if we look at education data, we see that Black youth are more likely to be suspended and expelled from school all the way down to pre-K. I have two kids. I don't know what a young person could be doing that deserves to be expelled from pre-K. And the fact that those rates are significantly different, and that disparity exists. Again, what does that say to a young person in those things? And we talk about, there's research around young Black youth being, this issue of adultification, right? That, young Black boys are seen as more likely to engage in criminal behavior, and Black girls are more likely to be overly sexualized and criminalized by others and adults that they interact with. And these things have, they have repercussions, they have outcomes. It changes how a young person can see themselves in the things that they are, that they're up against as well. It can impact education, self-esteem, self-awareness, sense of purpose, and thus create hopelessness and thus build these things that are risk factors for suicidal ideation and attempts. So it's definitely, again, there's layers. It's multifaceted, but these are some of the things that we know from work in the field.
Thank you so much. And I think it bears repeating that race in and of itself is not a risk factor. It's the experiences that one has because of their race that can be either risk or protected factors. And I think that bears repeating for our listeners here. And as you discussed, Black youth and young adults face well documented inequities in school and when receiving care. And these challenges are systemic, but their negative impacts are deeply personal to the youth, young people, and the families who support them and experience these. These inequities can manifest themselves in many ways. So, what are the risk factors caused by these inequities that our listening audience should be focused on?
Yeah, and so I went through a couple of them, but definitely being aware of exposure to racism and discrimination is definitely an important risk factor and one that we should all really be aware of. We get and hear people say that like young people aren't exposed to racism or they don't know what it is, and that's not true. And they do, and it has long lasting effects. Definitely, substance use is another one. Our young people being exposed to substances and things and using those to cope with those hopelessness and those feelings that they may experience. Is definitely one to look out for as well. Also, definitely having other young people around them who they lose to, whether it be violent, whether it be to suicide, can definitely increase risk as well. Like I said, our young people are exposed to so much, and even when we talked about Black youth and their experiences during the earlier days of the COVID-19 pandemic, that Black youth experience disproportionate rates of grief and loss in community, and those that impacted their daily their daily lives. And so managing and dealing with grief and loss, I think is another one as well. But really, understanding how to help our young people with self-esteem, with coping skills. And the other big one is traumatic life events. things happen, right? There are things happen and things that happen, to you or systemically that our young people experience. When we look at National Violent Death Reporting System data from the CDC and look at Black youth in particular and compare it to their white counterparts between the ages of 10 to 17, is that a traumatic event within the 2 preceding weeks of a death by suicide was disproportionately a precipitating factor for Black youth between the ages of 10 to 17. And so having those supports and again, wrapping our supports around young people during grief and loss, during, if they get suspended or expelled, if there's an eviction, like I said, a loss of a loved one, even a community traumatic event. We've seen the impact of, negative outcomes with law enforcement and other things. But there are definitely risk factors there as well. So things to kind of be mindful of with our young people.
Thank you so much, Brandon. And I know you peppered some of the strategies and areas where behavioral health professionals and our listeners can make a difference, but could you just please highlight a couple specific opportunities that behavioral health professionals can do to make a difference in the lives of Black youth and young adults when they're faced with the risk factors that you outlined?
Absolutely. Cultural humility is a big one and one that I speak about a lot. Kind of shifting from cultural competence, which really says, I can, ace a test on your culture, or like I know this certain amount of things. So like I'm proficient there. It's shifting to more of a mindset around cultural humility that says I'm never going to know everything about your culture, and that's fine. But what I want to do is understand how it impacts you, what it means to you, and how can we engage your, like your culture, your experiences in your healing process. How do we, put this together to kind of help you reach the outcomes that you want. And so just, being aware of those things, I think is incredibly important. Helping families to navigate the mental health care system and providing resources to let folks know where they can get services. For a parent, when your child is going through things, having mental distress or maybe exhibiting signs of suicide and other things, it's a hard thing to manage, trying to navigate the mental health care system. It's not easy for us professionals. Like we understand the gaps and the challenges with it as well, but building resources and things that you can give to a family about those resources, how to get connected to a mental health professional, what that process is like, giving people ideas of other places to look. So, calling your insurance company may be a place to go, or calling a hospital to see if they have services there as well. If, your services are booked, I think are important. And also, I think for mental health professionals and other behavioral health professionals, is really connecting to other community-based organizations within your community that are doing some of the social determinative health work. Faith-based organizations is one. There a lot of churches and other places, mosques, etc., that help to meet those needs, that have food pantries and doing, other things, helping folks with transportation. Going to those places and building relationships to say, hey, if there are people in your community that need help and support, that need mental health services, like we're here. Show up to health fairs, show up to, back to school nights, like go to those places so people know where you are, because it's hard enough to manage and find those things on your own. If you're there and present and can build that rapport as a trusted place for services within a community, there's so much that can happen from there. It can help support communities in that sense as well. And so I think those are some critical ways to do that. And then just engage with parents. It's challenging, and I think in suicide prevention we do a lot specifically around adults. We do a lot specifically around youth, but we don't do a ton around parents and caregivers. And so if we can engage with them, provide them with resources, and also ways to handle a crisis, ways to get connected, where are resources there, and how to manage their own mental health and well-being. Again, I'm a parent. Parents is not easy. It's a challenging thing. And there are so many pieces of it that you have to focus on. So making one aspect of it a little easier can definitely be a big difference in a young person's life.
Thank you so much for talking about the parenting and caregiver piece. In Ohio, we've been doing a lot of work around SAMHSA's Talk They Hear You program. And what started with underage drinking, it really extends into so much of the behavioral health world, including suicide prevention, because we know that strong parental and caregiver relationships are a protective factor. So I really appreciate you highlighting that today in our conversation.
Absolutely. Yeah, I just think it's one that um yeah, we can probably do a little better of because it's a tough thing because you're managing you're responsible for the well-being and mental well-being of, your children. But life doesn't stop for you at the same time. There are things that come up. There are traumatic events that come up for you as an adult. A lot of times in families, those traumatic events happen together. Grief happens typically together. Financial problems happen together. Like those things happen not just to your children, but to you as well. So how do you maintain your health and well-being and having resources there to help them, but also navigate the system for their children?
Oh, Brandon, I could extend this conversation all day, but I know you have a webinar to do this afternoon. And so we're going to have to wind our conversation down. And as we wind down, I hope to provide our listeners with one specific call to action. So, what is something that our prevention professionals or behavioral health prevention professionals who are tuned in today could do to forward the efforts of SAMHSA Suicide Prevention Branch?
Absolutely. So a number of things. I can't just do one. There are a number of things. Definitely continue to move forward and share 988, in that resource for individuals to call, chat, and text. We're excited to have that. The uptake has been amazing. So we definitely want as much as you can share that information with folks, the better. Again, be present, be connected within community is another important one. Always check out SAMHSA.gov. There's a section on suicide prevention there. We add resources there and definitely stay connected to the Suicide Prevention Resource Center. That is our technical assistance center that we funded SAMHSA to do suicide prevention. There are a number of resources there. There's a section in our resource library, particularly for clinicians. So definitely check that out. There are a number of resources there around zero suicide training, safety planning, reducing access to lethal means. All of those things are there as well, and that's another one I should have mentioned earlier, but reducing access to lethal means is another thing that clinicians can do, and SBRC has a training on that, on their website, so definitely look into that. Um, and just stay connected to other resources, that we're putting out. We're, working on, resources around Black youth suicide. SAMHSA has a Black youth suicide prevention initiative that I co-lead with Dr. Belina Shaw, to address this issue. We've also just recently released, a resource guide called Mental Health Promotion and Suicide Prevention for LGBTQ plus IA to Spirit Youth. It's a guide for professionals, but also family members as well. It's on SBRC's website. You'll see it as soon as you go to their website, sbrc.org. It's there. We definitely want you all to share that widely. And we'll be releasing another resource before the end of the month around faith communities in youth suicide prevention. So stay tuned for that. But just stay connected to us. Feel free to reach out to myself and others that you may see from the branch or from the 988 team. We're certainly here to help and want to partner with you.
Thank you so much. And our listeners who are maybe, you know, driving on their way to work or driving home from work or on a walk to take care of their own self, we'll be sure to put all these links in the show notes for you. And Brandon, this conversation has been really challenging and enlightening for me. And what I really love is how it's okay for both of those things to be true, right?
Absolutely.
And that's to me the mark of a good conversation. Uh, Now we're going to move on to our lightning round of questions, which are just our last questions that our listeners look forward to, just to get to know you a little better as a person. Because
Sure.
when you work with the feds, right, you've got you've got to have that personal face. So my first
Right.
question is this: carrot cake, should it be baked with raisins or without?
With. I like
With
it with.
with
Yeah.
raisins. And are you an early bird or a night owl?
Night owl, 100%. I'm not an early morning person, and in this new role, I have to be up early and late, so it's it's a lot.
It's a challenge. Absolutely. And this is a question I ask every single guest, and our listeners have been waiting for this. So you're reaching into that M&M dish. Are you looking for plain or peanut?
Plain, but, like, from the refrigerator.
Oh,
So,
cold one.
like, yeah, it's interesting, but plain from the refrigerator. I like peanuts too, but plain from the refrigerator, I'll go with.
Everyone has their own M&M preference. This has been a good question, but this is the first time I've heard M&Ms from the fridge. Oh, well, thank you, Brandon, for sharing your time and your experience with us here in Ohio. And importantly, thank you for your dedication to the people of the United States and for your public service. To our listeners, thank you for listening to the Ohio Center of Excellence for Behavioral Health Prevention and Promotion podcast, Prioritizing Prevention, Translating Science to Practice. If you enjoyed this episode and you'd like to help support the podcast, please share it with others, post about it on social media, or set the podcast to automatically download on your favorite channel. To catch all of the latest from the Center of Excellence, follow us on LinkedIn, Instagram, X, and Facebook at OH Prevention COE, or visit us at preventioncoe.ohio.gov to sign up for our monthly newsletter.
This has been the Prioritizing Prevention podcast. For more episodes, you can find us on Spotify, YouTube, Google Play, Apple Music, and many more. This program is funded by Ohio Mental Health and Addiction Services. And for more information about us, please visit preventioncoe.ohio.gov. Thank you for listening.